So imagine waking up in the year 2050 and going to the hospital. But it doesn't look like the hospitals we know today. AI systems are helping doctors diagnose diseases in seconds, and robots are assisting during surgeries. Some patients are being monitored remotely from their homes through wearable devices. And yet, something interesting happens. Even with all this technology, humans are still at the center of healthcare. Because the future of medicine isn't about replacing healthcare workers, it's about changing the types of jobs that exist. And according to multiple reports, healthcare may actually be one of the largest industries in the world over the next few decades. And in fact, the US Bureau of Labor Statistics projects healthcare will add about 1.8 million new jobs between 2022 and 2032, making it one of the fastest growing sectors. So if healthcare keeps growing, what kind of jobs will exist in 2050? Let's take a look at some of the roles that are likely to shape the future of medicine. The first category is something we're already starting to see today, which is AI-assisted doctors. Artificial intelligence is becoming incredibly powerful in analyzing medical data. AI can already detect certain diseases from medical images with a very high accuracy. For example, research published in Nature showed that AI systems can match or even exceed human doctors in detecting certain eye diseases from scans. But it doesn't mean doctors simply just disappear. Instead, doctors are becoming technology-powered decision makers. In the future, physicians may rely on AI systems to analyze millions of medical records instantly, helping them diagnose diseases faster and design personalized treatments. So the doctor of 2020 may actually look more like a medical strategist using powerful AI tools to guide patient care. Another job that is likely to grow significantly is telehealth specialists. The idea of seeing a doctor through a screen used to sound very unusual, but during the pandemic, telemedicine usage increased quite dramatically. And a report from McKinsey found that telehealth usage stabilized at levels 38 times higher than before the pandemic. So it's very possible that by 2050, a large percentage of healthcare consultations may actually happen just remotely. So doctors, therapists, and specialists may treat patients across cities, countries, or even continents. Healthcare will become much more connected and accessible. Another job that will likely exist in the future is called genetic medicine specialists. As science learns more about human DNA, treatments are becoming increasingly personalized. Doctors may soon design treatments based on a patient's unique genetic code. In fact, advances in gene editing technologies like CRISPR are already showing the potential to treat certain genetic diseases. So by 2050, we may see healthcare professionals who specialize in genetic therapies, helping prevent diseases before they even happen. Another growing field will likely be mental health and behavioral specialists. Mental health awareness has been rising quite dramatically around the world, and that's not a surprise. According to the World Health Organization, depression and anxiety already affect hundreds of millions of people globally. So, as societies become more complex and fast-paced, the need for mental health support may continue to grow. That means therapists, counselors, and behavioral specialists are going to play an even bigger role in healthcare systems of the future. Another interesting role that may become more common is health data analysts. Modern medicine produces enormous amounts of data. Electronic medical records, wearable health devices, genomic information. All this information can help improve healthcare by a lot. But that's only possible if someone really knows how to analyze it. So that's why future healthcare teams may include professionals who specialize in medical data analysis, helping hospitals and doctors understand the patterns in patient health. And finally, one of the most important healthcare roles will likely remain strong in the future is something very simple: caregiving, right? So nurses, therapists, rehabilitation specialists, caregivers helping elderly patients. And this is because as populations age around the world, the need for caregiving is also going to increase dramatically. According to UN, the global population of people aged between 65 and older is expected to double by 2050, so that's not a surprise, right? And an aging population means more demand for healthcare services. Even with advanced technology, many aspects of care still require human interaction, empathy, and trust. So helping a patient recover after surgery, supporting someone through a difficult diagnosis, teaching a child new skills during therapy, these are deeply human experiences. So technology may assist healthcare workers, but it cannot fully replace the human connection which is involved in caring for people. So when we think about the future of healthcare in 2050, it probably won't be a world where machines replace doctors and nurses. Instead, it's more going to be where technology and humans work together. AI helping doctors analyze diseases, robotics assisting during surgery, and data helping hospitals improve treatments, and healthcare professionals focusing on what they do best, which is helping people live healthier lives. Because even in the most advanced future imaginable, one thing is always going to remain true, which is healthcare is not just about technology, it's more about people helping people, right? And that may be the only things that machines will never fully replace. So that's going to be the end of this video. If you liked it, feel free to give it a thumbs up. I would really appreciate it. And make sure that you're subscribed to this channel because I'm going to be making more content like this in the future. Share it with your friends. Leave your thoughts in the comments, and I'll see you in the next one.